A 40-year-old man with a history of hyperlipidemia comes to the physician for an annual physical examination. The patient is 5'10" and weighs 243 pounds with a BMI of 35 kgs per meter squared. Waist circumference is greater than 45 inches and blood pressure is 142/92 millimeters of mercury. Physical examination, areas of hyperpigmentation appears in the folds of his neck. Fasting laboratory studies show high HDL, elevated serum triglycerides, and a fasting serum glucose of 130 mg per deciliter. The physician counsels that the patient should exercise and dietary changes may lower his serum glucose. Which of the following mechanisms best describes how exercise will reduce this patient's hyperglycemia? So go ahead and pause the video and try the question yourself before we go into the explanation. The very first thing that we should do is understand how sugars are absorbed after entering your mouth into the bloodstream. So here we have the lumen of the small intestine, and we have these receptors called SGLT1 receptors, which facilitate the entry of glucose and galactose, in addition to sodium coming into the lumen of the enterocyte. This is an example of what's called secondary active transport, because the sodium-potassium ATPase is propelling sodium to go against its concentration gradient. And the power of sodium going against this concentration gradient is allowing glucose and galactose to enter the cell. Because the sodium-potassium ATPase is trying to get sodium into the blood. And glucose and galactose are able to follow via SGLT1. Additionally, fructose is another monomer which can enter the enterocyte via GLUT5 receptors from the apical surface of the small intestine. So here we have glucose, galactose, and fructose in the lumen of the enterocyte, and these monomers can enter the blood via GLUT2 receptors. Now that we understand how sugar is absorbed into the blood, let's move on to skeletal muscle. So here we have skeletal muscle. Skeletal muscle is unique in that skeletal muscle has GLUT4 receptors, and GLUT4 receptors are sensitive to insulin. So insulin will bind to the insulin receptor, and that will lead to an increase in the amount of GLUT4 expressed. GLUT4 will allow glucose from the blood to enter the tissue and further drive metabolic processes such as aerobic or anaerobic respiration. Exercise is unique in that exercise will upregulate the expression of GLUT4 in skeletal muscle. Something else that's worth noting to point out is that adipocytes also contain GLUT4 receptors. So now that we understand how exercise affects glucose reabsorption into the skeletal muscle, in addition to how glucose and other sugar monomers enter the blood, let's go back to the vignette. So here we have a patient who has a body mass index of 35 kgs per meter squared. So this patient is obese, has a very large waist circumference, elevated blood pressure, areas of hyperpigmentation, likely acanthosis nigricans on the folds of his neck, elevated LDL, elevated serum triglycerides, and remember LDL is bad because LDL has fats stay in tissues such as your blood vessels instead of traveling back to your liver, and the elevated LDL is connected with diseases such as atherosclerosis. Elevated serum triglycerides and fasting serum glucose over 130 milligrams per deciliter. So this patient would likely be diagnosed with diabetes. However, the rest of the information in the vignette is describing a patient with metabolic syndrome. So this patient has metabolic syndrome. Now, which of the following mechanisms best describes how exercise will reduce this patient's hyperglycemia? If we had just read this part of the vignette first, we wouldn't have had to read the rest of it. But it's always good to read the rest of it just to double check yourself. But you actually didn't have to know that. All you have to do was recognize how will exercise reduce patients' hyperglycemia. So let's go through the answer choices. A, augmented secondary active transport. No, because exercise does not affect SGLT1 expression in the intestines. B, decreased glucose uptake. Well, if you're exercising, your body is going to want to be generating more ATP from glucose, so there would be an increase in glucose uptake. So that's not correct. C, increased insulin production. This isn't true because insulin production is not going to be increased from exercise. If anything, insulin production would be decreased because your body is constantly trying to ensure that there is more breakdown of fats rather than storage of fats. So that way, there is constant energy in the blood to be fueling skeletal muscle during exercise. D, increased lipid metabolism. So this is very interesting because there is increased lipolysis. So let's leave that one. There. E, increased translocation of GLUT1 receptors to the cell surface. So this isn't correct because GLUT1 receptors are found in the on the eye, the red blood cells in the brain. And F, increased translocation of glucose transmitter type 4 receptors to the cell surface. So this is exactly what is going to be happening with increased exercise. So between D and F, increased lipid metabolism is interesting in the sense that there is more activation of lipoprotein lipase, but exercise directly affects the increase in the amount of GLUT4 expressed at the cell surface of skeletal muscle, whereas decreased lipid metabolism is a more convoluted pathway, and exercise does not directly increase the amount of lipid metabolism. Rather, exercise will increase the amount of hormones released, which will indirectly lead to lipid metabolism. So between D and F, they're both good answers, but F is a better answer because it is directly supported by the science. So